CEN Test Prep Exam Grade 8. Question 1. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with Option A. A scalp laceration. Option B. An orbital wall blowout fracture. Option C. A nasal fracture. Option D. A mandible fracture. The correct answer is Option B. An orbital wall blowout fracture. Question 2. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is Option A. Diltiazem. Option B. Verapamil. Option C. Metoprolol. Option D. Digoxin. The correct answer is Option D. Digoxin. Question 3. The hallmark sign of compartment syndrome is Option A. Pain relieved by elevation. Option B. Pain out of proportion to the injury. Option C. Absent pulse in the affected extremity. Option D. Pitting edema. The correct answer is Option B. Pain out of proportion to the injury. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Hepatitis A is primarily transmitted via Option A. Blood and body fluids. Option B. Fecal minus oral route. Option C. Sexual contact. Option D. Contaminated needles. The correct answer is Option B. Fecal minus oral route. Question 5. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A. Abdominal X-ray. Option B. Abdominal ultrasound. Option C. CT scan of the abdomen. Option D. A complete blood count. The correct answer is Option C. CT scan of the abdomen. Question 6. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A. Restrain the patient firmly. Option B. Insert a bite block. Option C. Maintain airway and administer benzodiazepines as ordered. Option D. Obtain a stat CT scan. The correct answer is Option C. Maintain airway and administer benzodiazepines as ordered. Question 7. Testicular torsion is a surgical emergency that requires intervention within Option A. 24 hours. Option B. 4-6 hours. Option C. 2-3 days. Option D. It is not a surgical emergency. The correct answer is Option B. 4-6 hours. Question 8. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects Option A. Deep vein thrombosis. Option B. Acute arterial occlusion. Option C. Cellulitis. Option D. Compartment syndrome. The correct answer is Option B. Acute arterial occlusion. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to Option A. Patients with private insurance only. Option B. Any person who comes to the ED and requests care. Option C. U.S. citizens only. Option D. Patients with urgent conditions only. The correct answer is Option B. Any person who comes to the ED and requests care. Question 10. Which laboratory value is most indicative of acute kidney injury? Option A. Elevated white blood cell count. Option B. Elevated creatinine and BUN. Option C. Decreased platelet count. Option D. Elevated liver enzymes. The correct answer is Option B. Elevated creatinine and BUN. Question 11. Pulsus paradoxus is a classic finding in which condition? Option A. Cardiac tamponade. Option B. Pulmonary embolism. Option C. Aortic aneurysm. Option D. Congestive heart failure. The correct answer is Option A. Cardiac tamponade. Question 12. Meningitis is an inflammation of the option A, a brain parenchyma. Option B, meninges covering the brain and spinal cord. Option C, peripheral nerves. Option D, a ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Question 13. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C, document the observation in the patient's chart. Option D, call the police. The correct answer is option B, report the observation to the charge nurse or manager immediately. Question 14. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive 4-fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all 4 fluids. The correct answer is option B, keep the patient NPO and provide aggressive 4-fluid resuscitation. Question 15. A patient presents with sudden onset worst headache of my life. The nurse's first priority is option A, administer pain medication. Option B, perform a complete neurological assessment. Option C, prepare for lumbar puncture. Option D, obtain a non-contrast CT scan of the head. The correct answer is option D, obtain a non-contrast CT scan of the head. Question 16. In the Emergency Severity Index (ESI) 5- level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as option A, TSI level 1, option B, TSI level 2, option C, TSI level 3, option D, TSI level 4. The correct answer is option A, ESI level 1. Question 17. What is the priority intervention for a patient with an open fracture? Option A, immediate surgical debridement. Option B, apply traction. Option C, cover the wound with a sterile saline-moistened dressing and immobilize. Option D, administer analgesics. The correct answer is option C, cover the wound with a sterile saline-moistened dressing and immobilize. Question 18. Which finding on end-tidal CO2, EtCO2, monitoring indicates successful endotracheal intubation? Option A, EtCO2 of 0 mmHg. Option B, persistent EtCO2 waveform with each ventilation. Option C, PtCO2 of 50 mmHg. Option D, a flat line waveform. The correct answer is option B, persistent EtCO2 waveform with each ventilation. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. When receiving a verbal or telephone order in an emergency, the nurse should option A, carry out the order immediately without verification. Option B, write it down and read it back to the provider for verification. Option C, ask another nurse to take the order. Option D, refuse to take verbal orders. The correct answer is option B, write it down and read it back to the provider for verification. Question 20. The antidote for benzodiazepine overdose is option A, naloxone. Option B, flumazenil. Option C, N-acetylcysteine. Option D, atropine. The correct answer is option B, flumazenil. Question 21. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, tracheal deviation to the left, and hyperresonance to percussion on the right. The priority intervention is option A, obtain a stat chest X-ray. Option B, a needle decompression at the right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for intubation. The correct answer is option B, needle decompression at the right second intercostal space. Question 22. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is Option A, 250 ml of 0.9% normal saline. Option B, 500 ml of D5W. Option C, at least 30 ml/kg of isotonic crystalloid. Option D, packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C, at least 30 ml/kg of isotonic crystalloid. Question 23. Necrotizing fasciitis requires what priority treatment? Option A, broad-spectrum antibiotics alone. Option B, immediate surgical debridement. Option C, hyperbaric oxygen therapy. Option D, wound vac placement. The correct answer is option B, immediate surgical debridement. Question 24. In distributive shock, the primary pathophysiology is option A, pump failure. Option B, widespread vasodilation and increased capillary permeability. Option C, fluid volume loss. Option D, obstruction of blood flow. The correct answer is option B, widespread vasodilation and increased capillary permeability. Question 25. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A, a neurological status. Option B, a renal function and urine output. Option C, skin integrity. Option D, cardiac rhythm and rate. The correct answer is option B, renal function and urine output.